Good morning. I'm Meg Guerin Calvert. I'm delighted to be here at this conference, which is addressing a topic of global importance, but particularly of importance for South Africa, and very honored to be here. My background is I am a senior consultant at Compass Lexicon, a firm that is engaged primarily in antitrust economics. And have done a considerable amount of work looking at transformation and reform in the healthcare sector in particular through mergers and acquisitions, as well as in a number of other industries. I'm also president of the Center for Healthcare Economics and Policy, which is a new business unit in the economics practice of FTI Consulting. And our focus in this center is particularly to look at and engage with stakeholders, whether they be governments, employers, providers, funders, or others, on the issues confronting the healthcare sector. And what I'll be talking about in my session is some of those issues, and I think they fall into 3 or 4 categories. I think what globally is the major challenge is non-communicable diseases, or NCDs. This is cardiac issues, diabetes, obesity, a whole array of illnesses and disease syndromes that confront virtually every country and account for, remarkably, in 2008, over 60% of the deaths in the world. The second challenge that really comes from NCDs is that they affect many, many aspects of medical expenditures. And they will, over the next 10 to 20 years, account for a larger proportion. Many of them can be addressed by changes in the healthcare sector, but particularly by individuals and employers, individuals with regard to their changes in lifestyle, in taking a greater accountability for their own wellness and health. But what I will be speaking primarily to is what are the real challenges that keep the healthcare sectors across the world from achieving better population health, reduced costs, because it is the costs that are the fundamental challenge. All countries face an increasing proportion of their gross domestic product being accounted for by healthcare expenditures. And that's not just the medical expenditures, it's the absenteeism and the work-life issues that go with health as well. And so what the goal is, I think, really is to try to improve patient experience of care, to provide access to care, to have affordable care, and in particular to improve the outcomes and the quality that occurs. The challenges I think that we all face in healthcare reform, and this is at every level of the industry, is how to slow the rate of expenditure growth, how to improve outcomes, and how to provide access to high quality care. And there I think the particular challenges are in virtually every country, the healthcare delivery system is highly fragmented. We have many providers, physicians, professional staff, hospitals, outpatient clinics, hospices, rehabilitation, and typically these are owned and operated at a variety of different scales by a large number of entities. And in order to move forward to have higher quality outcomes, lower costs, we need to take care of that fragmentation and have more integration. So that's one particular large challenge. And the second part is we need to achieve not just cost cutting, but increase in value. I think if there's a single theme that I would say in my talk today is we need to do more than extract efficiency in healthcare, we need to extract and find value. And how do we go about doing that? I'm going to stress 5 themes. The first is accountability by everyone for prevention and wellness. This is in essence to shift more care to be delivered and obtained and accessed back at the primary care level so people take care of their own health. A related part is wellness, greater activities where individuals and others are accountable for their health care. The second part is to look at resources and the adequacy of resources. Do we have in each country enough of those resources that we need at the right place at the right time? A critical issue in most countries, South Africa and the US are two examples, is very significant physician shortages. And that's a critical issue to deal with. The third area is fundamental reforms on how healthcare is paid for, so not just on an episode and a fee-for-service basis, but for the entire continuum of care, and new purchasing models. The fourth area is to really find a way to integrate healthcare delivery, and will be speaking to many of the alternatives that have developed to have truly integrated delivery that touches patients from the very beginning in their homes, through the physician offices, through their inpatient care, through outpatient and rehabilitation care, all the way through to hospice in a truly coordinated way for the benefit of the patient. And then lastly, I will be looking at and talking about the importance of the necessary data and infrastructure. What we've all realized in healthcare is that in order to be able to track outcomes, measure wellness, examine rate of return, handle whether or not we are improving, we need to have very good data. And we also need to have accessibility of patient data in a privacy-protected way, in a secure way that enables physicians, hospitals, and others to really have information available to avoid redundant testing. So overall, it's a great challenge, but great promise. We're seeing across the globe a commonality, a real belief that there is a single approach to a set of principles, or a single set of principles to achieving value, but no one way, no single way that a country can actually attempt to implement it. So there's no one size fits all, just a common set of principles to look for affordability, access, and value.